Hi, it's Marcus Cheatham. I'm the health officer of the Mid-Michigan District Health Department, serving Clinton, Gratiot, and Montcalm counties in central Michigan. And I've got an extra COVID update report for the first week of April 2021. I've been making the rounds of county boards and talking to community partners. There's a couple things going on in the community I feel like you guys really need to know about. The first is that we are in the middle of a really big surge in COVID. It's very serious. And, we're public health. And so we need to warn you guys about that. And the second thing is there's a ton of vaccine on the way. It's a lot. And I just want to be sure um, you can see that coming. So, what I'm going to do to start with is share data and information from the Michigan Economic Recovery Council. This is the group that advises the state on their pandemic response. Uh, it's chaired by business leaders for Michigan, and the data are prepared by the state epidemiologist, my good friend, Sarah Lyon Callow. And it's really an amazing compilation of data, and it's at the link on your screen, BLM COVID-19. And if you're a geek like me, go ahead and take a look and see what's there. So the first thing you need to know is that the outbreak in Michigan is the worst in the country right now. On your screen, you have the 7-day average of daily COVID cases, and you can see Michigan is at the top. And in their report, the state says there's three reasons for this. The first is we have reopened, and it did not work out. That has accelerated the spread of COVID. The second big reason is connected to the first. It's COVID exhaustion. I think if you're out and about, you see people aren't masking, they aren't social distancing. So in other words, we're doing things that spread the disease. And the third reason is the new, more contagious variants, especially B117. It is really spreading in our three counties. And since it's more contagious, it just means things that used to work in the past don't work the way they used to. So it's surprising us, and it's spreading fast. So on your screen now is the trend in the 7-day average of cases. And you can see it's just really inflecting up there on the right-hand side. There's exponential growth, and we will soon be at the match the peak of the worst of the outbreak back in November and December. This trend will continue, and we will get there. We've got spring travel coming. We've got COVID exhaustion, the more contagious variant, and we can see it's going to increase for a few more weeks. The other bad indicator is the positivity rate. This is the percentage of COVID tests which are positive. And it's now matched almost the worst of the previous peak. It's up to 13%. In our jurisdiction, yesterday, it was up to 18%. That means people are seeking COVID tests because they've got symptoms and they're sick and they're worried. This slide is a little bit busy, and I've tried to make it easy for you to read. Each of the lines represents an age group. I put in the two yellow boxes. The yellow box at the top is showing you that the dashed lines are for people between the ages of 60 and 80 and above. And so the yellow box at the bottom is showing you that for those age groups, COVID has not increased. It's pretty much stayed flat. Almost all the increase is concentrated in younger people, and in particular, the light blue line is school-age kids, 10 to 19. So COVID has increased the most among school-age kids, and that's because we're playing sports And unfortunately, the High School Athletic Association overestimated its ability to get boosters to be safe. And so sports is spreading COVID into our schools and infecting our kids. So unfortunately, because it's younger people who are getting it, we could hope that they aren't getting hospitalized, but they are. So this is the trend in hospitalizations. And you can see it's also experiencing exponential growth. It's growing rapidly. And this means pain and suffering, right? To be hospitalized for COVID is a really bad experience. You can't breathe. And unfortunately, that is happening. In fact, the trends in hospitalization are as bad as they've ever been. This data, which you may have seen on MLive, comes from my friend Jim Lee at the Michigan Hospital Association. On the left-hand side, you can see it's broken down by age, younger people at the top. In the middle, you have the new daily hospitalizations from the peak back in the winter. And on the right-hand side, daily hospitalizations from now. And so for people between the ages of 30 and 49, you can see that the daily hospitalizations are as bad as they have ever been. In fact, these data are a week old, and daily hospitalizations for young adults have exceeded the worst that they have ever been. The good news is it's much, much lower. Look at the bottom two lines for people 70 to 79 and 80 and over, much, much lower rates of hospitalizations. So that is good. Hospitalizations are filling up our intensive care units. So the line graph is ICU admissions. And then down here at the bottom, I've highlighted the percentage occupancy for the Greater Lansing area and for the Grand Rapids area. And so you can see that our hospitalizations are really concentrated in the southern and western side of our jurisdiction, Clinton and Gratiot. ICU occupancy is up to 87% for that part of our jurisdiction. About as high as it can go is 90%. And the reason is you run out of nurses. You may have empty beds, but you don't have people to work. It's not quite as bad in the Grand Rapids area, and that is good. The surge in cases is definitely affecting your health department. So this graph is pretty busy. We're only going to be concerned with the middle two lines. This is performance data from our contact tracing and case investigation system for the health department. The second line down, the green line is for your health department, mid-Michigan, and the black is the state average. And this indicates when we learn of a case of COVID, are we able to get in touch with the person who is sick? So looking at the past few weeks, you can see, yeah, we were totally able to get a hold of people who were sick. In fact, we exceeded the state average. We were doing a great job. At the peak of the outbreak in November and December, we were completely overwhelmed. The whole state was overwhelmed, and we were not able to follow up with people who were sick. And then we recovered. The third line down says, even if you were able to get a hold of that person, were you able to reach their contacts? In other words, the people who they exposed. And unfortunately, you can see in the past couple of weeks, we've been trending down again. We haven't been able to figure out who a sick person exposed. There's two reasons for that. One is we're just overwhelmed and we can't keep up. But the other reason is COVID exhaustion. People don't want to talk to us. They don't want to tell us who they've been around. And this means you've got sick people walking around, making other people ill, and we don't know who they are. So the pandemic is just spreading faster and faster. Now, because it is younger adults, there is one piece of really good news, and that is deaths have not increased. Over here, this is the 7-day average of deaths for the state. And over here on the right-hand side, you can see the deaths have not gone up. So this is great. This is because Our seniors are vaccinated and they're not having serious cases. They're much less likely to get infected. So we aren't seeing the mortality. And in fact, locally, we're not seeing it. We're only having 2 or 3 deaths a week. At the peak, we were having 4 or 5 deaths a day. It was really horrible, and that is not happening right now. So we do have some good news. The superheroes are on the way, I hope, with the vaccine. So let's look at that. The data are through day before yesterday. So we have gotten 65,000 doses of vaccine into our 3 counties. That's really awesome. We have, looking down here at the bottom of this chart, 149,468, in other words, 150,000 eligible youths and adults to vaccinate. We've got almost enough doses to vaccinate half of them one time. So that's a lot. Even more of the people in our jurisdiction, they have received 68,800, almost 70,000 doses of vaccine. That's more than what actually came into our jurisdiction. We're using up all of our doses. And then our residents are going to other places like DeVos Place in Grand Rapids or Friend or in Lansing, and they're getting vaccinated there too. And they're supposed to. That's the state plan. So that's really, really great. Your health department has received 35,000 doses of the total. We've given a lot of those ourselves. We've shared a lot of them with state partners. Of the people in our jurisdiction who are eligible, 44,368 have received at least 1 dose. So they've initiated their 2-dose series. So if we have 150,000 people who are eligible, 44,000 of them have received at least 1 dose. And if we think 70% of them will accept vaccination, that means 44% have initiated vaccination, nearly half. So we are off to a really good start. So this line chart just shows the progress in vaccinations. The red line is the weekly doses that we have given, and the blue line is the progress toward our goal. If you have trouble with colors, the weekly doses is the jagged line, and the smooth line is percentage of our goal. So, looking at the red line, back in February, we were giving about 4,000 doses a week, and now we're giving 8,000 doses a week. We can see very soon we'll be giving 10,000 doses a week and then 12,000 doses a week. We know this is going to happen. And even more important, as the doses increase, we've been told by the state health department, it's going to be the Johnson & Johnson. And so that's a single dose vaccine. So that will double our speed. So we're going to be definitely by the end of May, everybody who wants to be vaccinated will have a chance to be vaccinated. There will still be people who struggle with the system. We'll be doing things to help them, and I'll be talking about that in just a moment. But the blue line, you can see its exponential increase in progress toward our goal. Almost 45% of our target population has been vaccinated. So this is a map of the mid-Michigan area. Excuse me. Our 3 counties in red. Our jurisdiction is kind of shaped like a dog leg. The foot of the dog is Clinton County. The knee of the dog is Gratiot County, and the hip of the dog is Montcalm. So look at Gratiot County right there. They're doing great. There's 2 numbers for each county. The top number is the doses per 1,000 people given, and the bottom is the total doses. So 424 people per 1,000 vaccinated doses received in Gratiot County. Compare that to Clinton County, 369. When you say, well, Clinton's not doing as good, but look, Clinton County has received a lot more doses, 29,310. Compare those numbers to the state average, of 409. So Gratiot County is exceeding the state average. Clinton County's trying to catch up. Montcalm is even farther behind. They've had 348 doses per 1,000, 22,000 doses delivered. That's not bad. We've been trying to do some things to help Montcalm and Clinton catch up, and I'll be talking about that on the next slide. So here are some of those things we're doing. For one, we are offering special clinics for agriculture. And this is a partnership with the Ionia County Health Department and the Bay Health Center. That's a federally qualified health center. And Bay is out of Belding, Michigan, but they are coming into our jurisdiction, all three jurisdictions and all three counties, and going to our farms and doing vaccinations. We've got 3 counties, Ionia has 1. So 3/4 of the vaccine is coming into our jurisdiction. So this is a really great partnership. We're very excited about that. And then we've got some mobile clinics, these big clinical buses with 2 vaccination rooms and a freezer to keep the vaccine good. And these are partnerships with Central Michigan University and with Sparrow Hospital coming into all 3 of our counties. And we're even trying to do a similar partnership with Michigan State University. And they're going into our rural villages to make vaccine available in places where people might have issues, traveling to get vaccinated. The vaccine is available to everybody 16 and over. Only the Pfizer vaccine is approved for people 16 and over, and your health department is a Moderna health department. So we've gotten a special shipment of Pfizer from the state health department. The Ingham County Health Department is holding that for us. And in a partnership with Sparrow Hospital, we'll be offering that vaccine in our jurisdiction. And we're also going to see if Mid-Michigan wants to offer some. And of course, if you're 16 and 17 and you want to, you can go to DeVos Place in Grand Rapids or Frandor in Lansing and get vaccinated there. We've also gotten some extra Pfizer vaccine into our jurisdiction. This is above and beyond the allocation the state was going to make available to us. And this is a partnership with Spectrum. So we're really grateful to them. That's brought an extra 3,000 doses into our jurisdiction. And then we just have, a ton of providers and pharmacies in our area that are offering the vaccine. We have 52 on our list, 52 places that are eligible to help with this vaccination effort. So if you go to our website, you can see those places and contact them. So in closing, I just want to say, since we're having this surge and it's bad, people are asking, are there going to be new epidemic orders? And so local health departments were talking with the governor's office today, and they said right now they don't have any announcements pending. So nothing in the works at the present time. We'll just have to wait and see what happens. So that's my update. I will be back as soon as I have new information to share. Thank you very much.